We've always prided ourselves on being innovative here at Barwon Mental Health Services, and I think we're known for that. Certainly over the last few years we've taken a unique cultural approach to recovery-oriented service delivery. We've worked with our staff on changing their hearts and minds and attitudes around the way we work with people in our service. So we're really ready to take the next step, and the next step is really around working with our community to co-design the services that we deliver.
So we have a real vision to be leaders both on a national and an international stage in terms of delivery of high quality mental health care to the community. We have a very active research department led by Professor Michael Burke, who's one of the most productive researchers in Deakin University. We actively promote research, we look very carefully, we audit and assess the things that we're doing. We're highly data driven, and we really want to make differences to the system and to the lives of the people that we care for.
We're about to do something different. I think for the last 3 or 4 years we've been working very hard to really think about how we provide care to our consumers and to our community at large. We've done a lot of work about changing the involvement of consumers in the process of our care and actually in the design of how we undertake our care, and now we're ready to launch off. This is going to be a completely exciting and new time for our service where really we're saying what's happened in the past and informs what's happening, but from here forward we're going to do something different. We're going to involve consumers in the process the whole way, which has really significant advantages, I think, about how we can have the most meaningful impact in the community. So for people who are really passionate about this sort of thing, about seeing how mental health services can be better, I think there could be no better place than to actually come in and have a really sustained impact.
What's innovative about working alongside the Barwon leadership team is their willingness to challenge themselves, to challenge the status quo, to ask the next question, to not just settle for okayness. I've been impressed about how Barwon will actually think about how do they support the staff, how do they reorganise their resources so that they can create the best opportunity for people to thrive beyond the impacts of mental illness. This is impressive, not settling for status quo.
So we're in a really unique position where we're looking to recruit a new leadership team. We're looking at bringing new skills to our leadership team, and they are around service redesign. We're looking at bringing the lived experience. So we're really looking for people with passion and innovation, for people who really share our vision around recovery-oriented service delivery and mental health. And what you gain is a huge amount of job satisfaction from working in a service that really cares, that really wants to make a change, and that really wants to create positive experiences for the people who access our services.